Start recording this. Yes, you're completely right, Lucy. It's one of the reasons why we were really keen to get you to come and talk about weaning premature babies. Because I rarely in my work see people talking about it, and actually it's really overwhelming if you've gone through that experience already. And then to have to think about weaning. So yes. Okay, so let me just check that's working. Yes, it is. Okay, so do you want to thank you first of all for joining and taking time out of your maternity leave to come because I know you're super busy at the moment with your little one. What's her name again?
It's Aurelia.
Aurelia, perfect. So congratulations and
thank you.
Do you want to tell us a little bit about you before we get started?
Of course. So my name's Lucy. I am a specialist pediatric dietitian. So basically means I just work with babies and children all the way up to kind of 16, 18. I've done this for many years now. I've lost count. So my background, I've worked a very long time until recently in the NHS. So done lots and lots of sort of hands-on clinical experience in big children's hospitals like Birmingham Children's Hospital, which is why when things like this come up, sort of premature babies and things sort of outside the remit of sort of general advice, it's great to be able to contribute, because these are the sorts of things that I would see time and time again in sort of clinics or on the ward or the neonatal ward and those sorts of things. So so my background's pediatric dietitian. I'm also a feeding therapist, and I suppose this works quite nicely with this group of babies too, because we know that premature babies can be sort of at slightly increased risk of feeding differences and difficulties compared to the general population. So that's certainly something I see quite a lot in feeding clinic. We pull back when we do children's histories, and there is a good percentage of babies that have a degree of prematurity involved. So I specialize in lots of different things. I really like allergy. I really like feeding. I really like the early years babies, weaning, and sort of those foundations that we have around kids and babies and nutrition. So yes, so I now work freelance. So I'm the director of the Children's Dietitian, which essentially is me and now my team of dietitians that are building. And we do like one-to-one support for families. We do workshops. And I do a bit of everything. I work with lots of different brands. I just really passionate about getting parents really empowered around nutrition. I think there's a lot of noise, like in the adult arena, and I think sometimes picking that apart is very difficult. So
brilliant. And now you're getting your practical experience with children.
Now I'm getting the years of literally looking after children, and now I've got my own bub, and it adds a totally different dimension of sort of empathy and understanding around things for sure. And I've reflected quite a lot with my partner. There's a lot of pressure around nutrition because you feel like you have to get it right, and then lots of people are trying to tell you the many different ways of getting it right.
Yeah, exactly. Cool. Okay, so do you have something are you going to talk about something? You've got a presentation prepared?
I was just going to talk, and I always think that this sort of conversation is a helpful way of people learning. They can just listen to it whilst they potter around the living room or whatever. So I suppose I've got a few things that people are quite commonly worried about or ask me when it comes to weaning premature babies. So the first question is always, are there specific guidelines? What should I be doing, or should I be doing something different? And I think it's really important to point out that unfortunately, there isn't lots of evidence about weaning premature babies compared to all this big bulk of evidence that we have about sort of I don't want to say normal babies, because that's not the right term, but babies who don't have any additional sort of medical needs such as prematurity. There's a little bit of a lack of evidence, and that makes it difficult for us to have really clear guidelines about exactly, for example, what you should be doing. And I think part of the reason that this is the case is because there is such a degree of difference in like the level of prematurity. I see babies born at 24 weeks. I see babies born at 34, 35 weeks. And that's a huge difference in terms of what medical complications there might be, developmental differences, long-term medical needs, babies who are tube fed or need oxygen or any of those sorts of things. So I think it makes it very difficult, therefore, to hone in on exactly what you should be doing sort of with this group. But there are lots of things that we do know, and it really is a very sort of individual baby by baby kind of scenario, and I sort of want to talk through a few things that you might want to think about or that come up for me whenever I used to sit in clinic and do neonate clinic. So the first is that age-old question, when should I start weaning? And I think when you've got a premature baby, you know, it can get really confusing for parents because you're throwing around actual age, corrected age.
Yeah.
What am I doing? So first thing I'll say is that actually quite a lot of babies that we see that are born at sort of anywhere between 34, 35 weeks of age, so they're still be considered early, but obviously not as early as some of those ones born much earlier, can actually start and follow normal weaning guidance for the most part. So unless there's anything that would need to consider, perhaps, you know, unless they were born sort of low birth weight or small for gestational age, generally you can crack on and follow kind of the standard weaning guidance, starting weaning around 6 months of age and sort of following the advice that it sits around complementary feeding, starting solids at that age. Now, for babies sort of born before this age, what we're looking for is a couple of things. The first thing I would say is that we tend to see most babies get going around 5 to 6 corrected. So not their actual age, their, you know, when they were born, sort of the from when they were due, 5 or 6 months corrected. And what it really boils down to, and this is why it's sort of a baby by baby basis, is that those real key developmental cues that we would talk about for all babies. And it might just be that premature babies reach these at a different time or need a little bit more support. So we would be looking for babies to be able to hold their head up. So normally we see this around sort of 4 months corrected age. We would want them to have relatively good sitting, although what I will say is often babies quite petite and need a little bit more support with that gross motor to begin with. Yeah. So if we're umming and ahhing about getting started, but they're showing us all the other cues, often we talk about really optimizing their seating position and providing some additional support, because the other thing I would say is lots of traditional high chairs can drown premature babies who might be a bit on the small side. And they're like, the tray is here.
I didn't have a premature baby, but my babies are quite petite. And because me and my husband are quite petite, and I went through with my first 3 different high chairs before I found one that actually didn't swamp her and where she looked comfortable and in a good seating position. So I can definitely relate to that.
Yeah. And so if they are, you know, still a little bit on the wobbly side, but you need, you know, you want to get going, you don't want to delay it anymore, and you've been given a sort of green light, maybe even from your pediatrician, what I would say is try wherever you can to adapt a suitable high chair. Some are just going to be too big and you'll put them in and go no, but a smaller high chair that where you can get little inflatable cushions now, you can use rolled up towels, blankets, boost them up. You know, you want them in that lovely seating position and nice and supported, so that they are not using lots of energy trying to keep themselves upright, because babies get knackered trying to hold themselves up and they can't focus on the task in front of them. And I mean, this goes for all babies, but something I talk a lot about with sort of premature babies. So yeah, they might need a little bit of additional support, sort of the core support with you. And then you're looking for those other cues. So you're looking for them to start having that hand-eye coordination, bringing things towards their mouth. You know, before then I would probably have expected them to do things like starting to mouth some toys, and you know, my daughter at the moment is everything is in her mouth. It's that age. And again, that sort of comes usually sort of around 4 months corrected. And we want them to be able to start swallowing food. So again, these are all things people will have heard before. So, but that will be very different for every single premature baby. Some will be sort of maybe ready at 5 months corrected, some at 6 months corrected. And actually, sometimes I see some a little bit later than that too. So I would say, look at the cues for your baby, think about what's going on. And, you know, if you've got a very, very premature baby, what I would say is normally there'll be a fantastic team around you, maybe speech and language therapy, physiotherapy. Ask them too. So physios and OTs can give you some really good exercises to work on to support, you know, the core strength and stability that children and babies need to basically start weaning. They can give you some advice around seating, positioning, and all those sorts of things. And I would say, you know, really tap into that, because people will hear me time and time bang on about the fact that you know, the process of learning to eat isn't just a nutrition focus. It isn't just a dietitian's role. It's looking at making sure that, you know, your gross motor skills, your fine motor skills, your sensory development, all of that sort of comes into play. So
and those people see babies all the time at
all the time,
different ages.
Yeah.
So they've got a really good grasp of when your particular child is in that spectrum.
Yeah, and what to do next. I think what can be really, really disheartening for parents, particularly if they're in a group, let's say, they've been to NCT and their baby's the only one that's been early and everybody else seems to be doing everything, is you can sometimes try and hopscotch like over to, oh, well, they need to be doing this now, so how do I make them do this? And there's actually some steps they need to do before that, sort of on the way. And it's always better to try and focus on what that next step is for your baby, rather than going, well, my baby isn't sitting up on their own for X amount of time and they can't do X yet, because you just feel pants. It's just absolutely pants. So
what do they say? Comparisonitis is the thief of joy.
Thief of joy. It really is. And I think, it's only natural. I certainly think I reflect on that much more as a new parent myself, is that, it is only natural when you're around babies of the same age or in the same sort of group and you go, oh, mine's not doing that yet, or yours is doing that. But, they're all doing different things at different times, and it's just not straightforward. But premature babies, you're looking at your baby, you're looking at corrected age generally. I mean, I think the Bliss guidelines, which are brilliant, by the way, if you've got a premature baby, used to say like between sort of 5 to 8 months uncorrected. Now I tend to say we're looking at corrected age. We're looking for those cues. And if you think about your corrected age, that sort of sits in line with when we'd be expecting them to do those skills if they weren't born early. That sort of makes sense.
Yeah.
So that's often question number one. In terms of some top tips, I mean, I'm going to talk about the nutrition side in a little bit. One thing I will say, and I'm going to put my feeding therapist hat on now, is that in my experience, babies born prematurely can really struggle with the sensory side of things. And there's probably a lot more work to be done to support positive sensory experiences for premature babies right from the beginning, because they might not have had as much skin to get skin because they're in an incubator. They may have been poked and prodded and had nasogastric tubes, oxygen, cannulas, constantly handled in and out of incubators, although they are very careful about that when babies are very, very, very small. And actually, that's not typical sensory development, and it can be quite aversive. What it's like if someone was constantly faffing with, putting things in and out of your nose or your mouth or on your hands, and we need all of this for eating. It can mean that children really, really need some support around positive sensory experiences, because eating is a very sensory activity and is quite hard from a sensory perspective. All of a sudden you're bombarded with smells, tastes, how things feel in your hands, how things feel in your mouth, all of, smells. So positive sensory experiences for babies before or around getting started with weaning. So letting them get messy, letting them have some sensory experiences, maybe it's water, maybe it's different things that you might be doing around sensory play, very gently before starting weaning can be a positive thing for these babies. And, my normal tips, like let's not try and scrape the spoon on their face between mouthfuls. Let's not wipe their face continually. Let them wear it, let them get messy with it, embrace it a little bit, because it's actually very, very important from a sort of development perspective that they have those experiences and that they are positive, because they've got lots of negative aversive experiences maybe around, their mouth, their nose, their face particularly.
I guess it's a bit just like exploring it as a messy play session.
Yeah, 100%. Yeah, absolutely. Just letting, in the same way we would with sort of babies who weren't born prematurely, we want them to just explore, and they're kind of primed around weaning age to be taking on lots of that information and sort of processing it and putting those building blocks together and all those neurons firing and learning about food. So, but yes, the other thing I would say is that it's not uncommon for premature babies to have experienced what I would call functional gastrointestinal concerns or disorders. Actually, reflux, really common. Stool changes, there can be lots of gut changes with premature babies. Essentially lots of the adaptation that was still going to be happening in utero is suddenly having to happen outside in the big wide world, with lots more things and factors influencing that wouldn't have been the case inside. So if you've had a baby who's been very refluxy, who has, been vomited quite a lot, again, that can be quite a negative oral experience. So look at your baby and think, how am I going to approach weaning from a positive perspective and not put pressure on, letting them perhaps, lead where they can themselves a little bit. I find that a lot with my refluxy babies in general. They want to do it themselves. They want to be in control, and facilitate that. And I mention that because the side what's often running parallel for premature babies is concerns about their growth or that they're small. And I think that can inadvertently mean that when you get to solids, parents feel a huge amount of pressure to be like, getting it in, get it in, get it in, get it in, get it in. Eat, please eat. I need you to catch up. And we use the term catch up growth. And food might have an important role with that as you progress through weaning a premature baby. So I talk a lot to parents of premature babies about being sort of a positive, having a bit of a game face on and being that lovely positive role model, trying to kind of park your anxiety at the door a little bit and remember that the process of learning to eat needs to be a positive one for them, and they are looking to you to cue that in for them. So if you're terrified, or or you're feeling pressure, or you're leaning into their space, or you've got spoons coming from all angles, then it cannot feel particularly pleasant. And actually
they feed off of that type of
because babies they don't have receptive language communication, do they look at your body language and read the room. They're so receptive to that. So it can mean a little bit of a game face, like inside you might be like, oh God, I'm hating every minute of this. But on the outside, we have to be looking like we're having a really great time. And isn't it great? Isn't it fun? And don't underestimate those sort of things that we would say for all babies, role modeling, making sure we're sitting at them in eye level, helping their development. Like, don't feed them from the side, look at them straight on and help them feed through their midline, because that's how we eat. All of those things are quite important. So that's me rambling off on one.
No, that's fine. You did actually, because you mentioned about functional gastrointestinal problems being increased with premature babies. Is there an increase of an increased risk or an increased incident of allergies within premature babies?
I ask this question a lot. At the moment, there isn't a huge amount of evidence that would suggest so, although what will be interesting to see is, because I think the gut health, the development of the gut microbiome and those sorts of things are basically under the microscope at the moment. We're understanding more and more. I'll be very interested to see whether there are elements of that feed into allergy risk, and that's still very much being looked at. Lots of the conferences I've been at over the last few years are sort of exploring that. But like anything else, some of the biggest risks for babies may be things like parents having atopic conditions themselves, eczema, asthma, hay fever, food allergy, or babies who develop eczema very early.
So the same sort of stuff.
Yeah, and I think because we see lots of the sort of the stool changes and discomfort, unhappy babies, reflux because of the prematurity, I see lots of questions around, does this child have a milk allergy? And some percentage of them do, but I would say it's not necessarily any more than sort of standard population. From what we know. I was going to talk about nutrition. Is that all right?
Yeah, go for it. It's so interesting and so helpful to parents to be able to hear this from you.
It is. I think it's a really lonely place when you've got a premature baby. My sister's a neonatal nurse. She's done it for years, so we always have lots of conversations about nutrition and feeding. And there's it can often feel like when your baby gets discharged perhaps from a neonatal unit or comes off their nasogastric tube feed or whatever else it might be, all of a sudden you're like, oh, hold on, what am I doing now? Like, I'm on my own, but I still have a baby who's very small, perhaps very delicate, and has had a really tricky journey so far. And now you're asking me to start giving them food, and are they going to choke? All those sort of normal concerns can really be sort of heightened, I think, when you've got a premature baby. So from a nutrition perspective, lots of people say, are there foods I should be giving my baby more of, less of? Is there anything to avoid? All normal weaning rules apply in terms of things that babies should be avoiding. So I won't go through all of those because that will take the rest of the time up. What I would say is that growth is often an area that is carefully monitored in premature babies, and where food can play an important role. But this is where I think getting some dietetic support is really, really helpful, because what we want to make sure when we're supporting any catch-up weight gain, and especially in premature babies, is that it is appropriate and helps them lay down muscle, not just fat mass. And actually what we can see is if we sort of overfeed, for want of a better term, or if we get those nutrition wrong and we're sort of, let's just give them loads of, let's not worry about giving them the variety of foods they need to learn about food. Let's give them, double cream in absolutely everything and X, Y, Z,
calories.
Yeah, which can be really, really important in terms of supporting growth, but it's a balance with making sure that we're getting all those other key nutrients, macronutrients, big nutrients like fat, protein, carbohydrates, and the micronutrients in too. So if you're worried about this or your child's got any growth concerns, I would anticipate that most babies should be under a dietitian anyway. And it's having a good conversation with them about how you build a nice balanced weaning diet, but maybe think about getting some extra calories in different forms. So, we might be thinking about adding in higher calorie options that aren't just fat. They offer protein, they offer carbohydrates, they offer other nutrients, as well. So, things like, let's think about making sure we get in oily fish, let's make sure we get in eggs, let's make sure we get in, avocados and healthy oils and those sorts of things alongside and appropriate alongside their milk intake too. So it's always a balance. And again, it depends on baby to baby. Some babies catch up quickly and hit nice centiles and plot beautifully. Others really are playing catch up until they're 2. And nutrition is the primary driver of growth and catch up growth before 2 years of age. So we sort of have that window of opportunity where we want to get it right. So please ask for some support. But I mean, otherwise, what you can give your baby, working towards that balanced sort of meal and iron-rich food, vitamin C-rich food, and some, an energy-rich food, which may be carbohydrate and or fat-based, is a good thing to aim for.
Perfect.
So yeah, it's all good. Just checking. I made some notes to make sure I didn't go off on one and forget anything that wasn't important. But yeah, and I mean, the thing I would say is, try not to compare, because every baby is going to do it differently and every premature baby is going to do it differently. If you are worried, getting some support from your neonatal team is really, really important. Dietitians are well skilled to support with weaning. If there's any concerns about your child's sort of oral motor skills, because again, I see that sometimes a little bit delayed, speech and language therapy are worth their weight in gold. They're fantastic. Loads of experience with premature babies. They're pretty much cemented as part of a neonatal team as well. So you should be able to access that, as is the case also with things like physio and OT. So yeah, I hope that's helpful.
No, really helpful. And I think as well, in my practice, when I see babies who are not premature, there is a huge difference between how quickly they take to weaning.
Some do it at 6 months and some do it at 9 months.
Exactly. and even between your own children, it can be entirely different. And I think sometimes it's probably your instinct to think that it's slower because of the prematurity, but actually it's not always the case. So you need to like reassuring parents that, they are all different regardless of when they were born as well.
Yeah, absolutely. And I think the other thing is, the one thing I would say is that when I speak to parents, there can often be a lot of worry about taking the next step with weaning. So they're like, oh, Lucy, they're on purees and it's great. And we're adding in, I know, X, Y, and Z, and it's all going really, really well. And I go, okay, cool. I want you to move on with texture now. And I think this really boils back down to, this is going well and I really don't want to change it. And I speak to so many parents of babies who've been in neonatal units, who have been premature, where it's taken so long to reach kind of a status quo, and that they're heading in the direction we want them to go in, that asking them to make a change can feel like this massive mountain. But like all babies, making sure we use that window of opportunity around texture and experience is still really important. And actually, I have lots of conversations about moving on perhaps more gradually with texture. So, lots of babies will do a little bit of puree, then can almost move straight on to mashed and seem to cope quite well with it. Whereas we might be working through thicker purees, grainier purees, really soft mashed, and again, sort of adapting it for that baby. And, often the success begets the success with these kids, is that they do well. You take a smaller step, that goes well. And it feeds in with confidence for parents.
So what would you recommend to a parent of a premature baby who maybe wanted to do baby-led weaning? What would your approach be there?
So I would say absolutely introduce finger foods, assuming your baby has started weaning and is showing the skills that they're going to be able to manage those. If they're still a little bit floppy and they're really struggling with that core support, that's a little bit of a risk factor for me. And that's where I would say, okay, we really need to make sure there's something under your baby's feet. They're really, really, really super supported. And we're starting with those really soft first finger foods to allow them to, explore and safely explore those foods. but in general, I would say once you're sort of getting past sort of those purees and into your sort of first sort of month of weaning, if they're doing okay, do introduce them, even if they don't go in their mouth, because that's the sensory stuff. Broccoli feels different to a carrot baton, which feels different to something else. You know, it's really, really rich experiences for them. And, you know, we want them to develop those skills. As I say, I see feeding difficulties are more notable, or feeding differences in children who are born prematurely. And I think it's going, what are these points that we're getting stuck on, and what can we do next? And again, that's where you know, your team will be involved in sort of helping you move along, because the time just goes, doesn't it? Because you can be like, oh yeah, Lucy, I'll get around to finger foods, I'll do it for you next month, and before we know it, 3 months has passed, because that's what happens. You blink and another month goes, doesn't it? So yeah, absolutely, just sort of look at those things. The other thing I was going to talk about was supplements. Lots of people say to me, they're giving different.
That was next on my list.
There you go. Yeah. So most premature babies will be discharged on specific supplements anyway. So lots of premature babies will be given iron, and normally it's continued to at least a year of age. So I would say you want to carry on with that. Getting in iron-rich foods is also important, because the bioavailability of that iron is going to be much better than a supplement, always. So getting in, you know, your oily fish, your eggs, your meat, if you're meat-eating family, things like kidney beans, red lentils, because again, they are really good for textures, actually, and people feel a bit happier giving those foods. Are really important. Your baby's also going to need, like general population, you know, a vitamin A, C and D supplement from around 6 months corrected of age. Sometimes they're given, though, a similar thing anyway. So I see lots of babies given additional sort of vitamin A, so it might be like Dalavit or something like that. So if you're not sure, or you're worried about giving more, then again, go back to your team who prescribes that and ask, do I need to be giving anything else or anything different? Because your Dalavit will cover your A, C and D, for example, and you'll be on iron anyway. So, you know, lots of babies have already got the right sort of thing. There will also be babies who might not be breastfed and might be on sort of specialist formulas. So your Nutriprem, you know, your Gold Prem, things that are slightly higher in calories, a little bit more protein. And it might be that those are providing the extra vitamins and minerals that you need as well. So again, it will be very individual, baby to baby. And I will still always reiterate here, because I'm dreadful at doing this and I know better. Breastfeeding mums as well. Lots of mums will be breastfeeding. Please make sure you're having your vitamin supplements too, at least some vitamin D.
Yes.
It's so hard to remember. I remember hers every day. Mine, they're there. They're right in front of me by my toothbrush. It's the only way I remember.
Yeah, 6 and 9 years down the line, it's no easier.
Right.
Much going on. There's
so much to think about. And I think that's the other thing I would reflect on for premature babies, is that, you know, parents are also probably going, you know, they might be on oxygen, they might be, you know, still giving lots of different medications. You know, they might be on sort of, you know, anti-reflux medication, they might be on thickeners, they might be on a whole host of other things, depending on what any other sort of comorbidities associated with the degree of prematurity. And I know food just feels like another thing that they have to do, and it's hard work. It's really hard work, but it offers a really, really good opportunity for your baby to have lots of positive experiences around their mouth, around food and around feeding. So
perfect. I think we're at the end of our time now.
Yeah.
Have you put everything in that you wanted?
I think so. Yeah, I'm just looking through. And my sleep deprived brain is like, have you covered everything? Yeah.
Very well. Very well.
I think so. And I would say, you know, my advice would always be, if you're ever wondering and you're ever not sure, then really, really reach out for advice. Bliss, so that's the premature weaning, premature baby charity, who are fantastic, have a great leaflet, and they have loads of information on their website. What's really frustrating for everyone in kind of nutrition arena is that there isn't sort of more evidence and more guidance going into this, and it's probably one of those things where actually they're a very vulnerable group of the population, and it's much harder for us to go, shall we do it this way, shall we do it that way, who's going to sign their child up to sort of trial. It's very, very different. So yeah, and you've touched on something that's really important throughout, is trust your instincts. You know, and finally, my final point, which I think actually might work quite well with who you've got later on today, is the other biggest thing I hear parents absolutely petrified about, because we have these very small, often very delicate babies, is choking.
Yeah.
and they don't feel like they can cope with that because physically they just can sometimes look quite small. Get yourself on a first aid course.
Oh, absolutely.
Actually, do you know what? Lots and lots of parents, particularly if you've had a very premature baby, so really quite early, before sort of 32 weeks, will be given training on some basic first aid before they leave hospital anyway.
Yeah.
And you can ask for that if any parents listening and you've got a premature baby at the moment who hasn't started weaning and you're under a team, ask, because they'll often cover things like choking for you too.
Excellent. Can you let everybody know where they can find you?
Absolutely. So you can find me on Instagram and TikTok, which is very new for me, by the way. I'm not sure I'm quite down with the kids enough to do TikTok. At Children's Dietitian with a T. We always say, I don't know if I'll be able to say this, we always say dietitians in the UK are tits, not ticks. That's how I remember. You can find me on my website. We're still running clinic. I've got some fantastic dietitians working for me who are doing a fantastic job of keeping my clinic going, and I will be doing some pop-up clinics and things like that soon. And as I say, Bliss, the weaning charity, the premature, get my words out, the premature baby charity has loads on weaning.
Yeah, brilliant.
So check them out, they're fantastic.
That's great. Thank you so much for joining us.
Thank you so much for having me.
And yeah, this will be invaluable to so many parents, and I know people will get it on the replay as well. So.
Yeah, absolutely. Well, look, I know you've got a really busy week, so enjoy, Nicola. Make sure you go get a coffee.
Yes, I will.
All right, lovely.
We'll speak soon.
Take care.
Bye.
Bye.